We move to matters of the situation of the coronavirus. Now, as of the press briefing on Tuesday, the Ministry of Health will now conduct major coronavirus tests on all those admitted on quarantine to suppress cases of the virus in the country. Director of Medical Services, Dr. Mustafa Bitey, told journalists that his ministry has now got reasons to either extend the period of quarantine or go ahead with mass testing for the virus. Whether this move will increase the figures on confirmed cases in the Gambia or not, Ibrahim Ba is currently on the press conference ground in Banjul to do the verifications. Well, thank you very much, Ibrahim, for joining us. From where will today's press briefing start? Are the arrangement the same?
Arrangement is slightly different, Amadou, because the excitement around meetings with the press officials is turning. Is no more the usual way with the Ministry of Health. Knowing the beginning, even though it was one case, the timeliness and the pressure or the attention given to the press conference was always, lively. But now it seems there is a sort of fatigue, and then, lot of, problem associated to in terms of respecting time, in terms of the number of people to face the press now, and the issues to discuss. The things are becoming more controversial day by day. So it is becoming completely difficult for one to predict what will happen unless and until the press conference starts. Yesterday we were told that the minister, although was in his office behind me here, he was tired because he's somebody who is having a sleepless night over the issues of coronavirus. So the director of medical services had to speak to the press. But as of today, none of this except the communication officer, the ministry, is yet to be on the ground, even though the press conference was scheduled for 4:30 already. It is about 5 now.
Now, what will happen to the number of cases if the mass testing is to be applied?
The mass testing is an option now, according to Dr. Bitey yesterday, that the Gambia has a reason to do now, because 2 cases that completed quarantine situation, period of quarantine, they completed it and then happened to be positive. So this was an excuse now that the ministry has to conduct the main test on anyone to be in quarantine center now on. And this is a situation where also they want to consider the increment of the quarantine period to 21 or 28 days, because it is the novel coronavirus is no more the same that they expected could be, noticed in a passing within the period of 14 days. So meaning the number of tests will increase, and so the number of cases could also rise up in this country.
All right. Now, there are, of course, challenges in the observations of the WHO's safety measures. Is this a concern for the ministry?
Yeah, the issue of social distancing is a concern in this country. You recall the other week when we were reporting from Tanje, it was as if there is no coronavirus in this country. At the seaside, you saw what happened at the border also. Even at the press conference ground, until now, journalists find it difficult to exercise the issue of social distancing, because we all continue to come to the regular press conference in the regular manner. The way it was being done before COVID-19 is the same way. Our cameramen have to, struggle to enforce the social distancing. So not only that, earlier on today, we were at the RVTH, the Royal Victoria Hospital, now called the Edward Francis Small Teaching Hospital, where the AfriCell money was being shared. You could see health workers, trying to exercise their registration for the sharing of that 12 million donated by the GSM company. So you wonder, what kind of Gambia do we live in when it comes to social distancing? So this is the call that the Ministry of Health continue to ask for people to respect authorities, respect these WHO, recommendations. They are safety measures, which if they are ignored, the speed of contamination or spread of the virus could be like a fire in this country, which no one is continue to pray for. for. No one is praying for this. But what is being done, what move has been taken for the community, for the public to respect social distancing in the public transport? You see it in buses, in all forms of transport. Even motorcycles are still carrying two people in our traffic. So the issue of social distancing is definitely something that the ministry should put more emphasis on. And it is a matter of time for us to see the press conference starting here to whether this will also be re-echoed and who will listen is the question that we cannot answer at this moment.
All right, good observations there. Ibrahim, just lastly, when is the press conference starting? Do we know?
So the cameras are here, the media is set, so it is all about now on the court of the Ministry of Health, which I believe they are here. This is their ground, and anytime they could come out. But this is something that it is becoming very difficult to predict because before the press conference, this ministry, the technicians have to meet and then vet their figures and then look up to what to say to the media. So this happens daily. So you remember this press conference used to be held in the morning. So and then because of time delay, it comes in the afternoon. It became 2 o'clock. Now it is 4:30, and usually the time for 4:30 is, executed for 6 o'clock or 7 o'clock.
All right, thank you very much. We're going to leave it at that. Thank you very much for your time. It was our, of course, senior correspondent and reporter, so of course, an editor, Ibrahim Prespa, speaking to us live from the Ministry of Health in Banjul.